Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We've got Josh in here with us this morning, all the way here from Miami, Florida. Josh is going to be with us over the next 3 days, getting adjusted twice a day for those 3 days. He came here to Houston today, found out we had a little colder weather than they have in Miami. It's down in the 40s here today, which is really cold for us. He comes in complaining of nerve pain and neck pain that radiates down into his left shoulder, arm, all the way down into his hands and fingers, specifically the index finger and the C6, which that is the C6 dermatome. So that is known as cervical thoracic radiculopathy. The nerve is being pinched in his lower cervical spine, which correlates with his MRI that he brought. He brought a cervical and lumbar MRI for me to look at this morning, which is also helpful because I can correlate that clinically with what his examination and history tells me. He's pinching the nerve out of the lower cervical spine that goes down in through his left arm into his index finger and thumb. He gets paresthesia, which is the numbness and tingling. He has low back pain and stiffness down in his right SI joint region. And then he has thoracic spine pain in the upper thoracic spine that radiates down to his left shoulder blade. He doesn't get headaches very often, once every 2-3 months, you said.
Yeah.
He has some sinus issues and occasionally has some acid reflux condition, which has gotten better as you've grown up, correct?
Yep.
And did I miss anything? I think I got it all.
I think that's it.
So this is his very first adjustment here at our office. How would you describe my history and examination to the people watching this YouTube video today for you? Because you've been to chiropractors before.
Yeah.
You told me.
Yes. It was very thorough and reiterated to make sure that you didn't miss anything.
Right. Right. Good. Good. Okay. Well, let's lay you back on your stomach, then, Josh, and I'm going to do your first adjustment on this table today.
All right.
So his left leg's only about 1/4 of an inch short down here. However, when I bring them up, it gets a little more than 1/4 inch longer on that left side, and this tightens up down in his lumbar spine. So that's a positive Deerfield on the left and a positive Nautilus with lumbosacral pain and tightness. He's got sacrum palpating on the left as well as the right, so bilateral sacrum issues that are affecting both SI joints. L5 is pretty tender to the touch. L4 also, and it's really hypertonic on this entire right side of his lumbar spine, all the way from his lower thoracic down to L5. Tightness in the mid-thoracic spine around T8, T9. Bilateral trapezius trigger points and hypertonicity, especially on this left side going down into his left shoulder blade. He palpates C5, C6 on the right here. C3-4 is also right. And he's got a little bit of C3, 2-3 on the right as well. So I'm going to do his first adjustment on his sacrum. I'm going to start off with the left sacrum, then the right sacrum, center sacrum, right SI joint, left SI joint. Let me get the lumbars here before I check that again. There. These might be a little tender at first, Josh, just because they've been out for a while. Yes, sir. A little deeper in person, huh, Josh?
Yeah.
Legs are now even. Tell me if this one tightens up as much as that first one did.
It feels actually a lot looser.
Yeah. See, it's even too. Stayed even the whole time. Good. So most of your stuff's coming from your lumbar spine and your sacrum. Now he has a loss of the normal cervical lordosis on his MRI, as well as disc bulging from C4 all the way down through C6. C4 or C5, 6 is the worst, which is why he's getting that left cervical thoracic radiculopathy. Okay, let's turn you on your back now, please, sir. Okay. I'm gonna bring your whole head up and over your spine. Yep. Now just put both arms out like this for me, Josh, straight out sideways. can relax your hands right there now. Let this right leg go like a limp rag. There we go. You should have felt that from your knee all the way up to your lower back.
I sure did.
Same thing here. Yes, sir. Cool. Okay, let's sit you face that way. Sorry about that.
Oh no, yeah, it's fine.
Here's your right shoulder. Left shoulder. There we go. Okay, let's come over on this table now, Josh. Josh said something to me during his history exam that watching our videos, he felt like this y-axis adjustment would help his condition, but he's a little apprehensive on his first visit, just like every new patient is. That's kind of what makes it fun. Okay. There we go. Not gonna get away now.
Nah, I'm coming in.
On this one, you just want to keep your teeth together, Josh. Don't bite your tongue. Get this under your mandible and your occiput. Deep breath through your nose. Mm-hmm. Yes, sirree.
Oh boy, that felt good.
Yes, sirree. You could have felt that all the way down your spine. I'm pretty sure you did.
Oh yeah.
Cool. Let me have you. Yep. Did that shoot pain down your left arm?
No.
Good. Good.
Surprising.
Well, I think this decompression adjustment, the y-axis adjustment, will help those lower discs
Oh yeah.
suck back inside. Pretty cool, huh?
Yeah, absolutely.
So here, let's stand you over here in front of the mirror again. Look at your hands now. See how they're even?
Yeah.
I'm gonna use this instrument to bounce your muscles. There's probably still gonna be some sore spots in there. Alright, now I'm gonna show you your homework. Your head's forward, pulling your shoulders forward, so pull these guys up and back first. Hold those there, please. These guys here. Then we're gonna bring your head straight back this way, then look backwards. You're gonna feel a little tap there. Right there, now relax. Try that same thing again, Josh. Tell me how this feels. It should feel a little smoother than your previous one, but you tell me.
Yeah, it does feel smoother.
Okay. So how would you describe your very first experience getting adjusted here at our office versus what you've had in the past?
It's all the adjustments are very deep.
Mm-hmm.
And they feel very effective,
Right.
so, you
You
know.
got movement, huh?
Yeah, like that and that when you're to the neck here and
Yeah.
And there, and it was very. That was just.
It's incredible,
yeah,
isn't it?
Yeah, and it's like I'm waiting to see exactly, keep coming and see exactly what.
Yeah, he's gonna be in twice a day over the next 3 days. He might do an interim video with him tomorrow if he's up for it, but if not, we'll do one on Wednesday when he gets ready to leave. So, we're going to keep an eye on his cervical thoracic radiculopathy this week and see if that lessens with the decompression adjustment and the BioPhysics adjustment. He'll let me know that every time. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Josh from Miami, Florida. We'll see y'all soon.